Hello friends, good evening to all. Friends, from tomorrow onwards, we are going to do a very interesting activity that I will share the details of that after today's session is over. But in today's session, there is one more important topic that needs to be discussed because that will be of utmost importance when we are giving the assurance to the patients at ground level. That is about the curability of a case. What are the factors which will help you to decide which cases are completely curable and in which cases the palliation is the only way? Which are those cases which can be completely restored back to order, and which are those cases where that reversible process may not happen? Accordingly, we have to advise our patients. And see, friends, the success of this platform lies in the fact that how to what extent we are able to produce those results consistently at ground level. And to show that consistency, it is important for us to take into account only those cases where we can assure that curability. Otherwise, there is no point in taking those cases which are not curable and we are claiming to cure it and we are not able to cure it, then that is falling under the failure list. So that should not happen. So it becomes very important for us to not to give any false hope to the patient. So very much important for us. It is very essential for us to understand what are the factors which decides the curability of a case. Now, to judge or assess the curability of a given case, we should always keep in mind the limitations that we have. Although we have a lot of advantages, our system has a lot of advantages over the conventional system of medicine, but still, at the same time, there are some limitations as well. So these limitations has to be kept in mind when we are giving that assurance to the patient. Also at the same time, we have to keep in mind, friends, that we are not gods. हम भगवान नहीं है कि हम लोग हर केस को जो है चुटकी में सुलझा के पेशेंट को ठीक कर देंगे. There are certain factors which are not in our hands and which can act as an obstacle in the process of care. So we should be aware of these things in order to give an assurance to the patient when we are taking the case through this application and platform. As a general rule, friends, keep in mind that in all those cases where there has been an irreversible damage done, complete cure won't be possible. Example, can anybody give me an example of a case where irreversible damage has been done? First and foremost thing, friends, keep in mind that the curability is not decided by the diagnostic name of the disease. Friends, curability is not decided by the diagnostic name. First of all, keep that in mind. Thyroid problems are just hormonal disturbances. They can be completely reversed. Diabetes can be reversed. There are some exceptional conditions. That is exactly the point of discussion today. So there are many factors which needs a detailed discussion, friends. Let's try to understand these. Now, see, we have seen that the overall health status of a person depends on the strength of his dynamic protective covering, isn't it? And at the same time, we also have seen that when a child is born, when a baby is born, the strength of the dynamic protective covering is pretty weak. And as the child grows, the strength also of the dynamic protective covering also grows. And in the old age, some degenerative changes happening as a process of aging, because of which naturally the strength of the dynamic protective covering becomes weak again. And in old ages, that is exactly the reason why many people end up having a lot of chronic complaints. So basically, we have already discussed that the vitality has a lifespan. Now we have discussed about the dynamic plane, we have discussed about the materialistic plane. As the aging process goes on, as the vitality starts diminishing, there comes a stage when the vitality begins to diminish and it gets exhausted. That is when the patient dies because of old age. So along with when the dynamic plane is getting diminished, the strength of the dynamic plane is towards the deterioration. Along with that, the materialistic plane also undergoes wear and tear conditions, and it is also undergoes a lot of degenerative changes because of aging and other things. And some symptoms are induced as a result of aging, as a process of aging. So those symptoms which are induced into the patient as a process of aging can never be completely cured. Please keep this in mind. Now, these symptoms which are induced into the patient as a result of aging process includes problems with vision, then the pain, arthritis, the patients who develop at the later age of 60 plus or 70 plus, the people who develop the pain in knee joints, weakness, those cannot be reversed completely. So if you are handling a patient who is having arthritis and his age is 70-75, do not ever assure them that we are going to completely cure it. That is not practically possible. Only palliation can be done to ensure that patient feels little better. See, friends, when somebody contacts me for this arthritis problem, the first question that I ask to them is the age of the patient. Patient का age कितना है? जैसे आपकी गाड़ी है 4-व्हीलर कार, आप उसकी सर्विसिंग करवाते हो हर 6 महीने में, हर 1 साल में जो भी है. तो जब तक नई गाड़ी रहेगी, आपको 10 साल 15 साल तक देखने की जरूरत नहीं है, वो चलेगी आराम से. लेकिन जिस तरह से आपका जो गाड़ी पुरानी होती जाएगी, उसमें प्रॉब्लम्स आने शुरू हो जाएंगे. एक टाइम ऐसा आएगा कि जब आपको गाड़ी बेचनी पड़ेगी, है ना, चेंज करना पड़ेगा गाड़ी. लेकिन सी द थिंग इज दैट the status of your engine, how good it is, and the status of your vehicle, how good it is, that is one factor. And how your tires are, आपकी गाड़ी के टायर्स कैसे हैं, वो अलग बात है. अगर ज़्यादा रनिंग की वजह से आपके टायर घिस गए हैं, तो आपको उसको रिप्लेस करना पड़ेगा. आपकी इंजन चाहे कितना भी अच्छा हो, खराब टायर डाल के आप गाड़ी नहीं चला सकते हैं, है ना. तो इंजन अच्छा होना और टायर्स अच्छा होना दोनों एक साथ जरूरी है. आपका इंजन अच्छा है लेकिन टायर खराब है तो आप गाड़ी नहीं चला पाएंगे. तो ये जो टायर है कैसे घिस जाते हैं चलाते, इसी तरह बॉडी भी यूज़ करते घिस जाती है. मतलब वो जो ओल्ड एज के प्रोसेस में, ओल्ड एज के टाइम में वो प्रॉब्लम्स आने शुरू हो जाते हैं. दैट कैन नॉट बी रिवर्स बैक टू नॉर्मल completely. Now, diabetes and hypertension are two very common conditions, friends, which we find in today's generation. Now, if a person is developing or becoming diabetic at a very young age, it should actually not happen, which means that that is not the age for that patient to become diabetic or develop hypertension. So, if somebody is developing these conditions at the age of 30 or 35, that can be completely reversed. But at the age of 65, 70 or 70 plus, if somebody is developing hypertension or somebody has become diabetic or diagnosed with raised blood sugar level, then also because of this aging factor, there can be some limitation to curing that patient. Even the hormonal disturbances, menstrual disorders, the thyroid problems, all these things which develops at a very young age, they can be reversed. Now, some ladies, the ladies, when they approach towards their menopause age, they develop some hormonal disturbances and functional disorders. Those things can be completely reversed. In old ages, see, all complaints which develop at the old age, I'm not saying that they are all incurable. Say, for example, somebody has lost their sleep at old age. If there is a specific reason behind it, we have to hunt for that reason, and those things can be reversed. We can ensure that the patient is getting a quite calm sleep. Now, see, friends, when I say that this kind of disorders can be reversed and this kind of disorders cannot be reversed, we also have to keep in mind is that this is not an unconditional rule. Say, for example, I have told that a person who has become diabetic at a very young age, it can be reversed and completely cured. But that doesn't mean that it is an unconditional rule. Sometimes, even in curable cases, there can be obstacles. The obstacles are basically of two types, one which can be removed and the second one which cannot be removed. So if the obstacle is something which cannot be removed, the case will get stuck. It will not proceed towards cure. Although based on the clinical condition we can say that this case is curable, but because of that obstacle being there which is not removable, the case will become incurable. Similarly, some clinical cases which can be generally categorized as incurable, homeopathy has shown that it can do miracles. Like in cases of cancer or advanced pathology, where we generally classify it as being incurable. Sometimes the Similimum can do wonders, and that is why homeopathy is far better known for doing miracles, isn't it? Now, in these obstacles, friends, one of the major role that plays is the willpower at mind level. Willpower of the patient, that has an important role to play. If the patient has decided that nobody can cure me, unless that mentality is not changed, of course that mentality can definitely be changed with some positive vibes in some cases, but unless that mentality is not changed, as long as the patient believes that nobody can cure them, nobody will be able to cure them. Friends, when I was teaching in college, one student had joined in the new batch, first year BHMS, and when you look at her face, you will can clearly notice that she is into depression. She doesn't talk to anyone, she doesn't interact in class, she sits always at back seat on a corner, she has no friends. And since that lady was also from Kerala, I was asked to take her case, and I still remember talking to her. When I started to give her some motivation, she has a lot of physical problems as well, thyroid problems and the other problems. When I tried to motivate her, she directly told me, sir, you are doing your job, but I know that no medicine can cure me. She was basically a Hindu lady, and she was telling me that unless she don't go to that combined mass prayer that these Christian community do, other than that nobody can cure her, and her parents were stopping her from going there because this lady belongs to a Hindu religion. And she very clearly told me that, sir, no medicine is going to help me, and you are doing your job, but unless I don't go there, no medicine can cure me. But when she, despite my best efforts to convince, she did not get convinced, and the medicine did not act only. It depends on the stage. If it is a hernia or fissure and fistula are totally different, they can be cured completely. But in cases where advanced prolapse has happened, surgical intervention is a must. No medicine can help. So as I said, friends, willpower has a big role to play, and that is why when we are talking to the patient in detail, we are digging their history for 40-45 minutes or 1 hour. The positivity that we give to the patient will help to a great extent to change their willpower, isn't it? I hope you all remember, friends, the first chronic case of my life which I have handled was a patient who was having migraine for 16 years. I have a number of times with all members discussed this case. And this lady was working along with one of my neighbor, and this person who was my neighbor had referred this case to me. And when he basically told her about me first time, then she took first reaction was, अरे छोड़ो सर, ये नहीं ठीक होने वाला, बहुत जगह मैं दिखा चुकी हूँ, माइग्रेन नहीं ठीक होने वाला. तो ये बंदे ने क्या कहा, ये बंदे ने बोला कि अरे वो तो आप तुम केरला के डॉक्टर्स को दिखा चुके हो, ये केरला से नहीं पढ़े, महाराष्ट्र से पढ़ के आए हैं. महाराष्ट्र में किसी जगह से पढ़ के आए वो मुझे पता है, लेकिन दैट इंप्रेशन कि अरे केरला से नहीं, वो बाहर आउट ऑफ स्टेट से पढ़ के आए हैं, उनका वहाँ पे जो है नॉलेज लेवल ज़्यादा अच्छा है, एक बार ट्राई कर लो. मतलब देखिए, वो एक फैक्टर था जो ट्रस्ट बिल्ड हुआ वहाँ पे, उसकी वजह से वो लेडी मेरे पास आई. तो विल फैक्टर वहाँ चेंज हुआ जब वो मान के बैठी थी कि आई एम नॉट गोइंग टू गेट क्योर्ड जस्ट बिकॉज इट वाज टोल्ड दैट दिस डॉक्टर इज फ्रॉम आउट ऑफ स्टेट, सम अदर स्टेट. So she got impressed, and ठीक है, and then remain that positive, that willpower which was completely on a negative side, just because when she was told that his doctor is from out of state, she got some hope to try, and the case taking ensured that she developed that complete trust. Then we were able to cure that case. So in each and every case that we have in our mind, in our hand, friends, the willpower of the patient plays a very important role. And you, along with case taking, you also have to assess the willpower of the patient. इसका willpower कैसा है? If willpower is good and strong, Similimum can do any wonders which even we cannot imagine. The next obstacle is, friends, the presence of maintaining cause. Maintaining cause can act as an obstacle. Now this maintaining cause, in some cases it can be removed and in some cases it cannot be removed. So in each and every case, you need to also access is there any maintaining factors, because sometimes it happens that you have selected the best possible simulation, but still it is not giving you the expected result. In such cases, you have to cross check, is there any obstacle in this case? If yes, then is that obstacle is something which can be removed or it cannot be removed? Or is there any other maintaining cause that is acting as an obstacle? So these things play a very important role in judging the curability of a case. Now, as far as the exciting factors are concerned, friends, these exciting factors definitely can cause some delay in bringing about the expected results, but it can be overcome, because when the patient is under our constitutional medicine, slowly but surely the immunity of the patient is bound to get boosted up. So when we are talking about boosting the immunity, we are talking about increasing the strength of the dynamic protective covering. So when the strength of the dynamic protective covering becomes strong, despite the exciting factor is there, it will not be able to trigger the susceptibility to bring about the symptoms or aggravation. Yes, Archana ma'am, that is exactly what we have to do. In those cases, if you realize that these cases are not curable, don't give any false hope to the patient. But at the same time, don't tell on their face that this is incurable. Some people may get offended with that as well. You can try that. You can tell them that this is the old people come with arthritis problem. You can tell to them very politely that the age factor is also something that we have to consider. So let's see. Let's try our best. So we can give some assurance, and we can definitely reduce their intensity of complaints. That will be a big relief to them. See, as far as autoimmune disorders are concerned, friends, again, as I said in the very beginning, the diagnosis doesn't decide the curability. Willpower of the patient, the other associated symptoms, the underlying pathology, all these things has to be taken into consideration together. And in my life, actually, I got only a chance to treat one patient who was having this autoimmune disease, and I have got a complete result in that particular case. Now, see, friends, the psychological disorders, the mental symptoms that develop at the old age. Can anybody tell me what exactly is the reason for these mental disturbances to come at the very old age? बहुत जब age हो जाती है 80 plus, 85 plus, 90 plus, people start behaving abnormally. They don't recognize members, they don't recognize family members, they roam here and there without any reason, they start take off their clothes, they start using abusive words, they behave like an insane person. What is the reason for that? Even in surgical cases like hernia or the prolapse, friends, that natural tendency remains in the patient. So even after surgery is done, how we can help the patient is that if we can keep these patients under constitutional medicine, it will help to ensure that the condition is not relapsing again. But with the things which has gone out of our hand, where surgical intervention is required, nobody can help us in that. We have to refer to the surgery. But we can at the same time assure the patient saying that next time it is not relapsed, our medicines can ensure that. That definitely is possible. See, deficiency disorders can arise because of two reasons. One is defective absorption, and second is defective assimilation. Now, of course, if the patient is not taking any food, intake is not there, that is totally a different case where no medicine. आप खाना नहीं खाएंगे तो मतलब आपको जो डेली इंटेक करना है, जिसमें से आपकी जो डेली नीड्स के विटामिन और अदर न्यूट्रिएंट्स मिलते हैं, अगर आप वो नहीं लेंगे तो डेफिनेटली डेफिशिएंसी आना है. बट इवन आफ्टर टेकिंग द गुड intake of food, if the patient is having deficiency disorder, then it may be either defective absorption or defective assimilation. In both the cases, the things are completely reversible, because if the things are not getting absorbed from the intestine properly, normally, then that is not something that is normal, right? Abnormality is involved there, and it's a functional abnormality. And defective assimilation is happening, then also that can be reversed completely. But again, the medicine has to be selected based on the totality, as usually we do for each and every other case. Definitely, ma'am. See, it depends. See, one, curability, as I said, I think 3 or 4 times I have repeated in today's session that curability is not decided by disease diagnosis. What age it has developed, what is the reason for that, what is the willpower of the patient, what is the underlying pathology, all these things has to be taken into consideration together. But this is an important topic, friends. Otherwise, see, if once you have added into our panel and you start consulting the patient, before judging the curability, if you start assuring each and every patient that it can be completely cured, it will create a negative impact for our platform. See, friends, curability is not decided by the clinical diagnostic name of that disease. So it doesn't make sense when you ask questions, sir, cirrhosis of liver ठीक होगा, sir, diabetes ठीक होगा, sir, migraine ठीक होगा, sir, asthma ठीक होगा. The diagnostic name doesn't decide the curability, friends. See, as a general rule, we can say that irrespective of the clinical diagnostic name, if the patient's willpower is strong, if there is no known obstacle in the case, and if there is no underlying irreversible pathology, we can ensure the patient that yes, you are curable, you will cure you. Of course, that aging factor also has to be taken into consideration. Basically, how our medicines work. Our medicine stimulates the vitality, and the vitality in turn removes from the body whatever needs to be removed. So it takes time for our medicines to act at a dynamic level and stimulate the vitality. So in all those cases where there is that much time is not there, because the pathology is progressing fast or the patient's condition is deteriorating fast, and we don't have enough time to stimulate that vitality, before we could stimulate the vitality, if the materialistic plane ends up in having some irreversible damage or organ failures, then that is basically a limitation. In cases of poison, this is actually what is happening. Some external violence, external material is acting directly on some vital organs and causing that organs to malfunction or fail. So in such cases, we don't have enough time to go and act deep at a dynamic level and stimulate the vitality and expect vitality to remove the poison. That much time is not given, right?